Welcome to Insightful Psychiatric Mental Health. My name's Mona Habib, and I'm a board-certified psychiatric mental health nurse practitioner with over 15 years of experience in this field. I wanted to highlight something special that we offer at our clinic. It's women's specialized and women's specific mental health treatment. So this includes conditions like PMS, PMDD, perinatal mood disorders, postpartum depression, postpartum anxiety, psychosis. This is oftentimes a specialty that can be kind of difficult to find treatment for. Oftentimes patients will, discuss some of their mental health issues with their OBGYN during pregnancy or even before or after. And it can be difficult to figure out who would be the right person to talk to about these issues. Well, that is something that I do specialize in. And I kind of wanted to go over some of the common perinatal mental health conditions. So like I mentioned before, there's postpartum depression, which is a common condition. It's characterized by persistent sadness, hopelessness, difficulty coping with daily tasks. There's also postpartum anxiety, which is quite common. It is characterized by excessive worry, nervousness, even sometimes panic attacks. There is postpartum psychosis, which can be quite dangerous. It's rare, but it's a very serious condition that involves delusions, hallucinations, paranoia, confusion. There's also prenatal depression. It's depression that occurs during pregnancy. There's perinatal obsessive compulsive disorder, which is characterized by intrusive thoughts, repetitive behaviors related either to the pregnancy or to the baby. Some of the risk factors that can increase the risk of developing perinatal mental health conditions include a history of mental health problems. So if you've already had a history of depression, anxiety, any kind of mental health issues, that does put you at risk. In addition, there's just having a stressful pregnancy can put you at risk, or a stressful birth experience can do that. A lack of social support, hormonal changes, sleep deprivation is a big one, and any history of trauma. So for diagnosis and treatment, what we want to look at is, do a thorough medical examination and a thorough psychological examination, both of which can be done by, a primary care provider, an OBGYN, and obviously the psychological evaluation can be done by your mental health provider. That is something at my clinic that I offer. So treatment options typically include psychotherapy, so working one-on-one with a therapist, address any emotional difficulties, discuss different coping mechanisms. There's medication, which is kind of my area of specialty. Sometimes, depending on the case, we might want to try a certain kind of medication to help with the symptoms. So either an antidepressant, anti-anxiety medications are common, sometimes even mood stabilizers. In cases of psychosis, then we also want to look at antipsychotics. In addition to therapy and medication, social groups can be helpful. Support groups, connecting with other parents who've had similar experiences, similar challenges, they can provide support and counseling. When it comes to prevention, so early screening can be very helpful. So regular checkups with your healthcare provider to monitor your mental health, education, providing information about perinatal mental health conditions and resources, support, having a support system. So social support can be very helpful, encouraging strong social networks and access to support systems. If you or your loved one or somebody you know is in need of any women-specific mental health treatment, please do contact us. In addition, some of the things I didn't go over were PMS treatment, PMDD. Those are also specialties that we can take care of for you. Again, you can reach out to me via my website, www.insightfulpmh.com. Or you can give my office a call as well, 913-257-7038.